Hi there, and welcome to Infoco. We are going to talk about sleep apnea today. What is sleep apnea? And how does it affect our sleep and overall health? Stick around and find out. Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts. If you snore loudly and feel tired even after a full night's sleep, you might have sleep apnea. Sleep apnea can affect anyone, even children. But certain factors increase your risk. The three main types of sleep apnea are: obstructive sleep apnea. This is the most common type and will occur when the muscle in the back of your throat starts to relax. These muscles support the soft palate, the triangular piece of tissue hanging from the soft palate, uvula, the tonsils, the side walls of the throat and the tongue. When the muscles relax, your airway narrows or closes as you breathe in. You can't get enough air, which can lower the oxygen level in your blood. Your brain senses your inability to breathe and briefly rouses you from sleep so that you can reopen your airway. This awakening is usually so brief that you don't remember it, and that is when you might snort, choke or gasp. This pattern can repeat itself from 5 to 30 times or more each hour, all night, impairing your ability to reach the deep, restful phases of sleep. Central sleep apnea. This occurs when your brain doesn't send proper signals to the muscles that control breathing. This is a less common form of sleep apnea that occurs when your brain fails to transmit signals to your breathing muscles. This means that there is no effort to breathe for a short period. You might awaken with shortness of breath or have a difficult time getting to sleep or staying asleep. Complex sleep apnea syndrome. This is known as treatment-emergent central sleep apnea, which occurs when someone has both obstructive sleep apnea and central sleep apnea. Sleep apnea is a serious medical condition, and the several complications can include: 1. Tiredness during the daytime. The repeated awakenings associated with sleep apnea make normal, restorative sleep impossible, making severe daytime drowsiness, fatigue and irritability likely. You might have difficulty concentrating and find yourself falling asleep at work, while watching TV or even when driving. People with sleep apnea have an increased risk of motor vehicle and workplace accidents. You might also feel quick-tempered, moody or depressed. Children and adolescents with sleep apnea might perform poorly in school or have behavior problems. 2. Heart problems. Having obstructive sleep apnea increases your risk of high blood pressure, hypertension. Obstructive sleep apnea might also increase your risk of recurrent heart attack, stroke and abnormal heartbeats, such as atrial fibrillation. If you have heart disease, multiple episodes of low blood oxygen, hypoxia or hypoxemia, can lead to sudden death from an irregular heartbeat. 3. Diabetes. Having sleep apnea increases your risk of developing insulin resistance and type 2 diabetes. 4. Metabolic syndrome. This disorder, which includes high blood pressure, abnormal cholesterol levels, high blood sugar and an increased waist circumference, is linked to a higher risk of heart disease. 5. Sleep-deprived partners. Loud snoring can keep anyone who sleeps near you from getting good rest. It's not uncommon for a partner to have to go to another room, or even to another floor of the house, to be able to sleep. The signs and symptoms of obstructive and central sleep apneas overlap, sometimes making it difficult to determine which type you have. The most common signs and symptoms of obstructive and central sleep apneas include: loud snoring. Episodes in which you stop breathing during sleep, which would be reported by another person. Gasping for air during sleep. Awakening with a dry mouth. Morning headache. Difficulty staying asleep, insomnia. Excessive daytime sleepiness, hypersomnia. Difficulty paying attention while awake. Irritability. Loud snoring can indicate a potentially serious problem, but not everyone who has sleep apnea snores. Talk to your doctor if you have signs or symptoms of sleep apnea. Sleep apnea is a sleeping disorder that can be treated. Sleeping well is the key to a healthy life. If you think you might have sleep apnea, see your doctor. Treatment can ease your symptoms and might help prevent heart problems and other complications.
To summarize, sleep apnea is a sleeping disorder that can be treated. Sleeping well is the key to a healthy life. If you think you might have sleep apnea, see your doctor. Treatment can ease your symptoms and might help prevent heart problems and other complications. Share your thoughts and comments below. If you enjoyed this video, give it a thumbs up and share it with your friends so we can keep making them. For more videos like this, hit the subscribe button and remember to click on the notification bell. Also, be sure to check out other of our videos as well. Thank you for watching.